Well, terms like dementia and Alzheimer's are often used interchangeably, but they're not the same thing. We are thrilled to welcome in a couple of memory experts from Baptist Health, Dr. Mark Pippenger and Dr. Anthony Davis, here to have an important conversation about not only the differences, but there's some exciting news in the field that you gentlemen work in. So let's get to it. Let's talk a little bit about the question that I just talked about, which is the difference between dementia and Alzheimer's.
Sure. Yeah, this is a problem for a whole lot of people because it's difficult to understand that a bit. Dementia is a general term. It's best described as like an umbrella term. Dementia is a clinical syndrome. So dementia is defined as having a decline in memory or thinking ability that reaches a point that it interferes with function. Dementia then is basically the clinical appearance of one of these diseases. Dementia is caused by any of a number of diseases. So the dementia is then the umbrella term. Alzheimer's disease is a specific disease which is defined by its pathology, which includes A-beta 42 amyloid and hyperphosphorylated tau. Those are the plaques and tangles. And so it's defined by the tissue pathology, but it's the most common cause of dementia, so common that many providers will interchange the terms.
Even the providers are doing that.
Even medical providers will use dementia and Alzheimer's disease interchangeably because most of the time when somebody has dementia, it's due to Alzheimer's disease.
Yeah, well, let's talk about the criteria you're using because that has changed a little bit, isn't it?
It has radically, actually, a couple of years ago. For many years, the clinical criteria for Alzheimer's disease required the presence of dementia in order to diagnose the disease. For about 30 years, though, we have understood that the disease we know as Alzheimer's disease begins a couple of decades before any symptoms appear. And so the disease goes on a long time before people start to become forgetful and develop dementia. So, our criteria used to, though, demand that dementia be present in order to diagnose it. That made the clinical criteria more accurate. But a couple of years ago, we developed drugs which can treat the disease in earlier stages. So we now had a reason to try and diagnose the disease separate from the syndrome, and that's what happened in 2024. A working group from the Alzheimer's Association published new criteria, and we now define the diagnosis by biomarkers or by specific
and I
tests.
want Dr. Davis to get into some of the treatments here in just a second, but let's talk about these tests specifically that you can get that will identify something earlier.
We call them biomarkers. Biomarkers basically some kind of test where if you have the test positive, it means the disease is present. An example most people are familiar with is blood sugar. If blood sugar is high, that means you have diabetes most of the time. So we developed biomarkers for Alzheimer's disease many years ago for use in research, but we had no reason to use those in the clinic until we developed these new drugs. So with the new drugs, it's very, very important that we be 100% sure that we're dealing with Alzheimer's disease. So there are certain biomarkers which have been designated as core 1 biomarkers. In the new diagnostic criteria, any one of those core 1 biomarkers positive means a diagnosis of Alzheimer's disease.
Okay, and so and on the treatment side, Dr. Davis, a lot of exciting things happening here as well. But one of the things that you would intuitively think is that the earlier we start, the earlier we recognize that we have a diagnosis, the more successful the treatments are going to be over a long term. Is that right?
Correct. We are finding that patients that are unfortunately further along in the disease don't respond as well to the medications that we have that have been shown to slow decline over time.
So when we're talking about slowing down the disease, because as of now, there's not a cure, but we can sure slow that progression down. What does that mean to people? What does that look like?
So that's a common question, and it's difficult to tell how will my loved one look different on these medications because we don't have somebody to compare them to directly. And so in the studies, if we gather up 1,000 people and we put them on the medication, then we have 1,000 people not on the medicine. Over 18 months or even longer, now that we're having more data, the decline or the chances of them going from a mild to a moderate phase of the disease is much lower in the patients that are on the treatments.
You can't overemphasize that enough. I mean, that's just a phenomenal breakthrough there. Do we know anything about the side effects of these new medicines yet? I know that we're still you know,
So-
in its infancy?
We're very cautious with them. They do have a risk of something called amyloid-related imaging abnormality, which is bleeding and swelling in the brain. The good news is 75% of people had no symptoms of that at all. And we monitor, first we pick patients very carefully on who should be on the medicines. And also we monitor with MRI and frequent visits, especially in the beginning when that's the highest risk of those side effects.
When we can get these tests and learn earlier that we perhaps have to prepare for what's ahead, do you have people who say, I don't want to know, I don't want to find out early? That's kind of self-defeating in a way, isn't it?
Right. Well, occasionally people do feel like it's a stigma, there's something attached with it, but I really want to combat that Alzheimer's equals dementia, because that's not true anymore.
Yeah,
You have
yeah.
people that have Alzheimer's with no symptoms completely, and so if we separate that stigma, then that will hopefully get people more comfortable getting diagnosed earlier, because it doesn't change the outcome. It's like not knowing that you have cancer. You want to know as fast as you can.
No question about it, especially because that, again, we're slowing down that progression. To the both of you guys, what does the future look like? I mean, are we going to continue to progress by what appears to be leaps and bounds in a lot of ways?
Well, it's hard to overestimate or overstate how much research is going on with Alzheimer's disease. I've been in this 30 years or so. I've been going to the Alzheimer's Association International Conference since before it was called that, and it's a yearly research meeting, the biggest one in the world. And I can tell you that it used to be that we all were sort of resigned to having to deal with the disease and keep looking for things that would work more effectively. But in the last few years, there's been a great buzz and excitement at these meetings because we have so many drugs that we're working on now. These new drugs that we use, the infusion drugs, have a real promise to substantially slow the disease to the point that some people may avoid ever requiring placement in any kind of rest home or things.
You'll essentially outlive the progression
outlive it.
of
You'll
the
die
disease.
of something else before it gets that bad.
Yeah.
And we have a real chance of that for many people now, but we're working hard for multiple types of medicines hitting multiple areas of the disease.
It's wonderful news. Dr. Davis, you're as optimistic as well, right?
Absolutely. We're looking at new pathology to combat not just the amyloid like we currently do, but also tau, which is that other protein that Dr. Pippenger mentioned.
Yeah. Gentlemen, thank you so much for this conversation. Really good. It's heartening to hear that there's good news and progress being made. 188 Baptist, of course, is the best way to find out more information about any of your health issues. You can also check them out online. Guys, thank you. Appreciate it.
Thank you so much for having us.
My pleasure.